I think it's everybody got impacted by Corona. Definitely, there's not as many patients coming into the outpatient for visits, and it's become fairly difficult to convince patients to come and be seen. We started doing teleconsults for sometime around early June or late May. I think then it was 100% because all of the medical arts buildings were closed. Um, Recently, or a few months ago, the medical arts buildings in various hospitals started to open. But even now, I think I'm probably seeing about 70 to 80% of my patients online, and about 20% of them probably come to clinic. It's there. A lot of the patients have actually begun to appreciate not having to travel to the doctor's clinic anymore, and I think telemedicine lends itself fairly well or nephrology lends itself fairly well to telemedicine. We're not as uh, we're well, we still do, but not as much in terms of physical examination dependent as our other subspecialty colleagues. Um, and we really do need more time to discuss with patients the the status of their health, the implications of the medications that we're putting them on, what options are available to them, and this really requires more time than anything to discuss, not necessarily examine, and being able to discuss these things with them can, I think, adequately take place in an online environment.
The pandemic, of course, has drastically changed our outpatient clinics. We have limited the number of hours we spend at the clinic, we limit the number of patients that we see, we encourage appointments and discourage walk ins. My secretary screens the patients on the phone, and the hospital triage also screens all patients for signs and symptoms of COVID-19 prior to allowing them to enter the medical arts building. About half of my consults are virtual consults now. In fact, the moment the lockdowns were imposed, my colleagues and I already started virtual consults. We were fortunate enough to have subscribed to an EMR program that was capable of virtual consults. So we found it very convenient during the lockdown, especially for patients who are in the provinces.
In the early months of the pandemic, there was really a significant decline in my outpatient consults. Well, after the lockdown, the hospital implemented rules and regulations to limit and minimize the risk and exposure of both patients and healthcare workers. So, with this, actually, our clinic days were limited to just twice a week and allotting 3 hours per clinic day. So I can recall that there were actually days that I had no OPD consults at all, and these patients were actually instructed to do or to ask for appointment from our secretaries. But recently, during these past months, there was an increase in the number of patients who wanted to do face-to-face consults. But this was also reduced as compared to the numbers pre-pandemic times. So these patients, as I have said a while ago, go through scheduling or appointment via phone or text messages through our secretaries. And actually, our secretaries were also trained to do telephone triage, meaning to say they already screen for symptoms while they ask for schedule. Um, our patients are also advised regarding the time of consultation so as to avoid overcrowding in the waiting areas. So that is actually what I can share with our experience here at Baguio during the pandemic.
Nag-decrease yung number. Kasi most of them prefer online consults na because of the fear of getting this COVID nga. Especially, bulk ng patients natin are senior citizens. So, nung early last year, pre-COVID, talagang frequent, steady yung number of patients. I mean, in a way, you can predict how many patients you can see in your clinic each day. But with the pandemic, we had to adjust the schedule, we had to limit patients, kailangan, tawag muna, so you can control the number so that they won't crowd your little clinic space. But, meron pa rin namang patients na, yun na nga, they prefer seeing their doctors face-to-face. Iba pa rin yung meron kang interaction with your doctors kasi. So, meron pa rin patients na hindi natatakot lumabas, pumunta sa clinic, sa hospitals.
When the pandemic started, it was a very difficult time for everyone. Many people were scared to go out. And parents were afraid to bring their children to my clinic, even with reassurances that protocols are in place for their safety. Those who need more healthcare were also hesitant to have in-person visits since they will be directed to the emergency room. Although quarantine restrictions have relaxed in the last quarter of 2020, the number of patients were still significantly very low compared to pre-pandemic time. Its impact was very imminent. Even scheduled vaccinations were delayed, and for 6 months, I did not have any patients, so I was forced to temporarily close my other clinics and maintain only one.